There's a couple of other terms that we will talk about next that are easily confused with each other, but are important to know. One is a reportable disease, and one is a quarantine listed disease. As you can imagine, part of the work of epidemiologists in public health is to determine which infectious diseases are the most dangerous to a population. And that kind of work leads to the development of lists and recommendations about how to prevent these diseases from causing an outbreak. So we have in this country what is called a list of reportable diseases. And like the name suggests, these are diseases that health professionals are required by law to notify local, state, and federal authorities if they see them. These are diseases that are reportable. Anytime, again, these health professionals make a diagnosis or a probable diagnosis of any of these diseases, they have to report that to public health authorities. That can include both local and state, and depending on the disease, federal health authorities. Let's take a look at some of these reportable diseases. The first one is acquired immunodeficiency syndrome, or AIDS. Anthrax, multi-drug resistant tuberculosis, what are called the animal arboviruses, and you've heard of some of these if you've lived in New England for any period of time. Triple E is on this list. WEE, or Western equine encephalitis. Then there's one called VEE, Venezuelan equine encephalitis. These are diseases that are passed through vectors. They are mosquito-borne diseases. And again, we have triple E in our area. That's Eastern equine encephalitis. But there are other versions of that encephalitis disease in different parts of the country. There are several different encephalitis diseases that are spread by ticks. West Nile is another encephalitis type disease that is considered in this list. There are also a group of diseases that are called animal vesicular diseases. The most famous of those are hoof and mouth or foot and mouth disease. The Zika virus is now considered a reportable disease. And believe it or not, influenza is a reportable disease. So every year, people who are diagnosed with flu, so it's not you saying to yourself, I think I have the flu, but it means going to the doctor and specifically, either being hospitalized with it or dying from it. That is reportable. So the physician that's taking care of you, who admits you to the hospital or who records your death, has to then report that to public health authorities. Now, reportable diseases are very different from what are called quarantine listed diseases. The reportable diseases, again, have to be reported. It doesn't mean that anything is going to happen when they are reported. A lot of the reason that diseases are included in the reportable list is so we can keep track of them, so that we can keep statistics, so that we know what we should predict in terms of their occurrence. That way, if we start to see levels of those diseases going up, we can respond. The quarantine listed diseases are different. These are diseases that we're going to respond to immediately, and we're going to respond using quarantine and isolation. The first on the list is cholera. Then there's diphtheria, which is one of our vaccinatable diseases. Infectious tuberculosis, plague, smallpox, which I said a minute ago is eradicated, but we still keep it on the list, yellow fever, which I've also mentioned, the viral hemorrhagic fevers, that's Ebola, and another similar one called Marburg, SARS, which is a coronavirus, MERS, which is a coronavirus, and now SARS-CoV-2, and again, certain strains of influenza. So influenza shows up on both lists. Influenza is reportable if it leads to hospitalization or death. Influenza is also quarantinable if it turns out to be a form of influenza that is epidemic or pandemic. Another term that is important for us to understand with regards to epidemiology is the term index case. All an index case is a first case, the first person who can be identified as having had an infectious disease at the beginning of an epidemic. Now, it's not always easy to locate that first case. A good example of that is the HIV/AIDS epidemic that occurred in the 1980s. A lot of work and a lot of money went into trying to figure out who the index case was for HIV/AIDS in our country. And for a while, public health officials thought they had identified the index case. It was a man who worked as a flight attendant and who had been determined to have not only had HIV, but to have passed it along to some of the very first people who became infected with HIV in our country. However, further work showed that this particular individual was not the true index case for HIV/AIDS in the United States. In fact, it was determined that the virus had come into the United States much earlier than 1981. It just had not taken off in the epidemic until the 80s. So it can be hard to find the index case. It takes a lot of detective work. Epidemiologists have to trace every case backwards to try to find out who that person was infected by and who that previous person was infected by, and so on, back in time in order to try to find that first case. Now, that kind of work is different from what we call contact tracing. And you've probably heard contact tracing mentioned in connection with our current pandemic. People are being trained to do contact tracing work, and they're being hired by individual states and localities in order to try to get a handle on the epidemic and pandemic around the country and around the world. Contact tracing is the process where we try to identify individuals so that they can be examined and either quarantined or isolated after they became exposed to or come in contact with people who've been infected. So we try to identify anyone who came in contact with an infected person so that they can be notified, essentially, that they've come in contact. They can then go for examination, and if they are found to need isolation, they can be put in isolation. Contact tracing is a critical part of getting an epidemic or a pandemic under control, because you have to identify probable exposures so that you can quarantine those people, and if they come down with the disease, you can isolate them so they don't infect anyone else. Contact tracing is a critical part of getting a pandemic under control. The other term I want to talk about, we talked about in the vaccination lecture, and that's this term, herd immunity. If you recall from the vaccination lecture, herd immunity is a general immunity to a particular pathogen and a particular infectious disease within a population. Herd immunity describes a level of immunity in a population that comes from either natural infection and recovery or vaccination. And it describes the amount of immunity that's required in that population to protect the entire population. And as we said, if a sufficient number of individuals in that particular community becomes immune, then a lot of good things happen. Number one, obviously, that means that there are people in the population who are immune. There are individuals who are protected. And again, the figure ranges from 60 to 90% depending on the infectious disease. But herd immunity means that a whole lot of individuals are immune and protected from that disease. But it also means that there will be less of that pathogen around. There will be less of that bacteria or less of that viral particle around in the community that could be a source of infection for other people. And finally, herd immunity means that the most vulnerable members in the population have some protection. The people who either are not immune or cannot become immune through vaccination for one reason or another. Now, you will hear a lot of different numbers thrown out around discussions of herd immunity for SARS-CoV-2. I've heard numbers as low as 40%. I've heard people talk about numbers around 60%. Computer models can determine the absolute minimum percent immunity that has to be achieved in order to get a pandemic under control. But generally speaking, for the most infectious, the most contagious pathogens, we want as many people immune as possible. And for many of them that we vaccinate against, like measles, we're aiming for about 90%. We would like to see 90% of the population immune to something like measles in order to feel like we have a true herd immunity achieved. For many infectious diseases, herd immunity is not going to be achieved until you vaccinate. It's not good public health practice to let a disease ravage a community in order to achieve herd immunity. It's much better to achieve it through vaccination. You'll save lives by achieving herd immunity through vaccination. The current hope for the SARS-CoV-2 pandemic is that by the end of 2021, we will hit herd immunity, essentially, around the globe. That there will be enough people who have a natural immunity because they survived a natural infection, and there will be enough people who have achieved immunity through vaccination that we will be at a herd immunity level. We will be at a place where the occurrence of the SARS-CoV virus will plummet. There will simply be much less of it around because we have achieved this level of immunity. That's our current hope. And we will know much more about the plans for releasing vaccines over the next few months.